Hi, I'm Karen Katz with the Office of Children's Mental Health. The Office of Children's Mental Health was created in the 2013-2015 biennial budget to support Wisconsin's children in achieving their optimal social and emotional well-being. You can see on this slide what our values and our vision are. They ground everything that we do. So values are collaborative across systems, data-driven, family and youth-guided, and promote inclusivity and equity among all stakeholders. We have three foundational pillars in the Wisconsin Office of Children's Mental Health, and we move by a collective impact process where we involve stakeholders at every level throughout Wisconsin in the children's mental health arena. We value lived experience. That means people that have children with mental health struggles and the youth themselves. And we are grounded in research and data. And so I'd like to begin this speaking engagement here with how are kids doing in Wisconsin? Here in this slide, you can see that we really focus on kids through their lifespan. So for example, the 0 to 5-year-olds, we really are looking at unrecognized mental health issues contributing to preschool expulsions. As you move up in 6 to 12 years old, we're really looking at, as a key indicator, losing the ability to make and maintain relationships. In the 13 to 18 year, we're looking at increasing anxiety, depression, and lack of belonging as they contribute to teen suicide. And with the older youth and young adults, age 19 to 26, we're really looking at the need of support and caring adults so that they can launch as adults to be mentally well and healthy. And you can see at the bottom, we really pay attention to so many other things that affect the kids throughout their life, the social determinants of health, and then the number of different adults that interact with them, all the way from educators, mental health supports, and peers and physicians. So I'd like to share a few data points now that really support some of the things that we just talked about. And so here, when we look at the ages 0 to 5, we're really looking at the expulsion rates and knowing that they are greatly affected by race and gender, and expulsion rates in general in preschool. So when looking at preschool expulsions, we find that boys, children with disabilities, Black children, and those from disadvantaged backgrounds are suspended and expelled at significantly higher rates and are much more likely to be introduced into the criminal justice system. This is often referred to as the school to prison pipeline. And so as we go up the age frame here, we look at difficulty with social skills, and we are finding that more kids age 6 to 17 are having difficulty in making and keeping friends. And this is an indicator that we track over the years, and you would find it in our Wisconsin Children's Wellbeing Dashboard. That's part of our annual report. Here, you can see that we look at a statistic for kids ages 13 to 18, where 40% of students in the 9th through 12th grades are feeling very anxious, nervous, tense, scared, or like something bad was going to happen in the past year. And this statistic comes to us from the YRBS, which is also known as the Youth Risk Behavior Survey. And then for older kids, we are really looking at the suicide attempts and reported. And here on this slide, you can see we break it down by Hispanic, white, and Black. And this again was from the national YRBS. And we see that Black suicide attempts and deaths have been increasing more quickly for Black youth than for other groups. And younger suicide deaths are more common for Black children. In fact, in the national YRBS, Black high school students report some of the highest rates of suicide attempts. In 2019, 11.8% of Black students reported having attempted suicide in the past year. And suicide deaths among Black youth ages 15 to 24 has increased by 47% for males and 59% for females between 2014 to 2019. And an additional point I'd like to make is that LGBT youth are more likely to consider and attempt suicide when compared to cisgender and straight youth. A Trevor Project study found that 40% of LGBT youth and over 50% of transgender and non-binary youth had serious suicidal ideation. An interesting fact is that youth who had their pronouns used correctly by others, most or all of the time, had lower rates of suicide attempts compared to those who did not. And the ability to use gender-affirming clothing, such as shapewear and binders, also reduced suicide attempts among transgender and non-binary youth. Here we come face to face with the effects of the pandemic. And here we see, when we look at insurance companies' reports of claims submitted in 2020 as compared to 2019, that there was a 100% increase in self-harm, substance use, and mental health claims. And then as we wrap up our focus on data here, this is a very interesting slide that really shows us the relevance of social connectedness in youth and the percentage of kids in Wisconsin who are not socially connected. So we say kids are socially connected when they have enough relationships to make them feel like they belong, are cared for, valued, and supported. However, not all Wisconsin kids are supported well. So here we see in a 2018 to 2019 data point that 55% do not engage in community service. 41% say family does not always share ideas well. 40% do not live in a supportive neighborhood. 28% have difficulty making and keeping friends, and 17% are not engaged in school. And here we can just take another look at this definition of social connectedness, which really is a focus for our office in this year and as we go forward into the next year. So youth, again, are socially connected when they are actively engaged in positive relationships where they feel they belong, are safe, cared for, valued, and supported. And just to continue with the social connectedness topic here, we've identified 5 categories where youth can be socially connected, and organizations can support that through family, supportive adult, peer, school and early education, and cultural identity and community. And we are really working with our networks now to identify how they support the social connectedness of youth in one of these categories. And so now I'd like to wrap up with just identifying some resources that are out there and available. These are all on our website, and our website is children.wi.gov. But we were very pleased to work with the Department of Public Instruction this past year on mental health literacy units of instruction. And this is units for grades 3 through 12 that are available on the DPI website. And there's also a caregiver engagement manual so that it can go from the classroom where teachers are grabbing onto these literacy units of instruction, and then caregivers at home can support that. It's a wonderful resource, and we encourage people to go find it. It's on the DPI website. We also have a link to it on our website. We also have a wonderful tool on our website. It's a live map here that shows the different youth mental health peer groups that we have discovered in the state of Wisconsin. So you can hover over any of these points, click on it, and it will tell you the organization, where it's at, what school it's at. And this map, again, is available on our website also. And so I'd like to just quickly run through some real rock solid tools that are on our website. And we call these all part of our OCMH toolkit. So here first is our mental health crisis card. And the idea of this card is it's a wallet-sized card that a youth can fill out, carry with them, take a picture of it on their phone, and it says what calming strategies would help calm them down. The idea is that in the first 5 minutes of an agitated state or a mental health crisis are very critical moments. And a supportive adult could read these calming strategies and then just do them. And it would hopefully calm the youth down. They wouldn't escalate into a full crisis, and the situation would obviously be better than if they did not regulate and calm down. So this is available on the front page of our website. You can download it, print it, and cut it, and then just use it. We also have a wonderful companion piece. It's called our Feelings Thermometer. And this is a visual tool that helps kids and adults measure how they're doing emotionally and consider steps that they can take to shift how they're doing. So as you escalate, like if you are feeling frustrated or annoyed, you're in what we call this orange zone. Here are some things that you can do to calm down. You can listen to your favorite music. You can take a walk. It's a great tool. We've had tremendous success with it. And it was really intended to help families when we were in the early days of COVID and everybody was living really in close quarters. And we were hearing a lot that there was a lot of frustration, anxiety, anger. And so the tool has been received wonderfully. And again, that's available on our website also. We also have a great tool. We call it our roadmap for accessing children's mental health services. A lot of times when families are just realizing that they may have a mental health issue with a child, they don't know where to go. They don't know where to even start the process. It's not a clear-cut process. And this map will walk you through what are the steps, what do you need to do, step 1, step 2, step 3, step 4, and hopefully just guide parents through that process. We also have a number of wonderful imagery on our website. We use these a lot during Children's Mental Health Awareness Week. But these are visual images that we ask people to go and download and share via social media. And it really all helps to start to destigmatize mental health. We also have wonderful data resources. We have monthly fact sheets that we publish on a variety of topics. We publish them the second Tuesday of the month, and they explore a children's mental health topic, provide data, a description of what's happening in Wisconsin on that topic, and then on the backside, we state recommendations for action. So be it recommendations for policymakers, for schools, for individuals, for families, a great resource. We also have some trauma-informed care training, and we're really building more of these resources. But what we are focusing now in this trauma-informed care training are videos, the half-hour videos that a team of people could watch together. So a team of school counselors, maybe, county staff, and they're on topics. The one here you see is the collective trauma of the pandemic. And then the idea is we have a bunch of experts speaking about it in a panel situation. And then there's a toolkit that the people watching it can review and discuss after they've viewed the training. We also have a long list of supportive resources for families on our resources page, a lot of organizations that are working in children's mental health. And again, these are all available on our website. And then I just wrap this discussion up by showing you who we are in our office. We are a mighty team of 4. We report to the governor's office, so our director is appointed by the governor, but then the pillars really line up with what the staff does. So I handle the collective impact. We have a brilliant researcher, Kate McCoy, and she handles all of our data. And Andrea Turtenwald works and coordinates our families and our youth engagement, the people we call lived experience partners. So we invite you to visit our website and just appreciate having a chance for organizations to get to know more about us.